Good morning, guys. My topic is about cervical vertebrae. Before going on the procedure, make sure that the person called is the right patient and with the right procedure.
Good morning, ma'am. Ma'am Ramos.
Yes.
64 years old for cervical diagnostic X-ray po. Okay.
Upon confirmation, tell the patient on what she needs to do for you to get the desired image and make sure the patient is comfortable. Since the patient cannot assume recumbent position, we're gonna do the AP upright. Shield the gonads and tell to suspend respiration upon shooting of the X-ray. AP axial projection. Place the patient in the supine or upright position with the back against the IR holder. Adjust the patient's shoulder to lie in the same horizontal plane to prevent rotation. Center the mid-sagittal plane of the patient's body to the midline of the table or vertical grid device. Extend the chin enough so that the occlusal plane is perpendicular to the tabletop. This prevents superimposition of the mandible of mid-cervical vertebrae. Center the IR at the level of C4. Adjust the head so that the mid-sagittal plane is in straight alignment and perpendicular to the IR. Provide support for the head of any patient who has pronounced lordotic curvature. Central ray. Central ray is directed to the C4 at an angle of 15 to 20 degrees cephalad. The structure shown are the resulting images shown to the lower 5 cervical bodies and the upper 2 or 3 thoracic bodies. Lateral projection, Grandi method. An SID to 60 to 72 inch is recommended because of the increased object to IR distance. A longer distance helps show the C7. Position of the patient. Place the patient in a true lateral position, either seated or standing, before a vertical grid device. Have the patient sit or stand as straight and adjust the height of the IR so that it is centered at the level of C4. Position of the part. Center the coronal plane that passes through the mastoid tips of the midline of the IR. Move the patient close enough to the vertical grid device to permit the adjacent shoulder to rest against the device for support. Rotate the shoulders anteriorly or posteriorly according to the natural kyphosis of the back. Adjust the shoulders to lie in the same horizontal plane. Depress them as much as possible and immobilize them by attaching one small sandbag to each wrist. Be careful to ensure that the patient does not elevate the shoulder. Elevate the chin slightly or have the patient protrude the mandible to prevent superimposition of the mandibular rami and the spine. Central ray. Horizontal and perpendicular to C4 with such centering the magnified outline of the shoulder furthest to the IR is projected below the lower cervical vertebrae. Structure shows a lateral projection of the cervical bodies and their interspaces. The articular pillars, the lower 5 zygapophyseal joints, and the spinous process. Lateral projection, hyperflexion, and hyperextension. This procedure must not be attempted until cervical spine pathology or fractures has been ruled out. Position of the patient. Place the patient in a true lateral position, either seated or standing, before a vertical grid device. Have the patient sit or stand straight and adjust the height of the IR so that it is centered to the level of the C4. Position of the part. Move the patient close enough to the vertical grid device to permit the adjacent shoulder to rest against the grid for support. Keep the mid-sagittal plane of the patient's head and the neck parallel with the plane of the IR. Alternatively, perform the projection without using a grid. For hyperflexion, ask the patient to drop the head forward and then draw the chin as close as possible to the chest so that the cervical vertebrae are placed in a position of hyperflexion for the first exposure. For the hyperextension, Ask the patient to elevate the chin as much as possible so that the cervical vertebrae are placed in a position of hyperextension. Central ray is horizontal and perpendicular to the C4. Structure shown, the resulting images show the motility of the cervical spine when hyperflexed and hyperextended. The intervertebral disc and the zygapophyseal joints are also shown.